Welcome to Thursday Thought Leaders with Arvinder Narula on BW Healthcare World. My guest today is Dr. Bharat Bhosale, who is the founder and director of Sunrise Oncology Centre, renowned for his expertise in oncology and his dedication in providing cutting-edge cancer treatment. Now, with a background in medical research and patient care, Dr. Bhosale has led the center in the forefront of cancer care, emphasizing innovation, emphasizing compassion, and focusing on excellence. Welcome, Dr. Bharat Bhosale. Thank you so much for joining us on Thursday.
Thank you.
And Dr. Bhosale, as a business leader, I want to ask you, because you're a doctor and who's now running an institution, as a business leader, what strategies do you employ to ensure that the center remains at the forefront of the advancements in oncology while we are maintaining the patient-centric care?
So, as you mentioned, my journey is from a clinician, as a doctor, seeing a patient and developing Sunrise Oncology. This is a private limited company where we have a daycare, chemotherapy daycare in Goa, Thane, Vasai, Mumbai, different area of Mumbai. So this is a business, how we grown ourselves as a business person. But corely, I am a clinician, I'm a doctor. And if you look at this as a business, this business is for the patients. The end user is the patient. And there are so many innovations happening. And those innovations are happening for the betterment of the patients, because there is a real problem at the population level. Cancer incidence is increasing. So somebody, listens the word cancer, it's like most of the patients feel that it's end. So the impact which last decade has created in cancer, there are so many innovations have happened across the globe. Unfortunately, we are in the third world country. We are in a developing nation. We are moving towards a developed nation, maybe 2047. We are quoting that we will be a developed nation. Yes, we will be. But till then, those innovations which are happening abroad or in the Western world, are they reaching to our patients? So that is why we looked at patient-centric approach, because this business is by patients and for patients. And we are a doctor who are now taking these innovations. But the most important thing is affordability, accessibility. These are the two important obstacles which are creating a problem. Now, if you see, there are governments, there are NGOs who are trying to help, but there are limitations. So the institution like Sunrise Oncology Centre, where I have my partners, two of them are also oncologists. One is an MBA person. So we thought of coming into a public domain rather than sitting in the government hospital, because I was in Tata Hospital, which is a central government funded biggest cancer hospital. When I was in Tata Hospital, there was only one Tata Hospital. And then now there are different regions of the India. There are many Tata hospitals. So there are different branches of Tata Hospital. Still, the number of patients traveling to Mumbai Tata Hospital is so huge. It has actually doubling it's doubled in the last decade. And all those hospitals like Varanasi, in Punjab there is one, in South there is one. There are many hospitals under the name of Tata, because people have the trust in Tata. The Tata name in cancer is the biggest name. That is like similar, cancer is Tata, and we all are trained in Tata. My colleagues are trained in Tata. So journey started like that. We used to sit in the OPDs even after I becoming a consultant. I used to have student under me. We used to sit and see 150 patients in a day. So there are needs apart from the treatment. There are emotional needs. We have to listen to the patients. We have to give time. And for that, you need multiple aspects to understand. There are emotional needs. There are financial needs, which a doctor cannot address. There needs to be a counseling. I'll give you one example. There are cancers which are very bad, but there are cancers which are very good. The outcome is like 100% cure. But for a patient's mind, cancer is dead. You have to sit with that patient. You have to sit, many counseling sessions have to be there. So a doctor alone cannot be, doing this exercise. Otherwise, he has to see only 4 or 5 patients. So that is why, apart from clinician, you need an NGO to provide the financial needs. You need a counselor who is a psychiatric counselor. You need a person who is tying up with you to provide the drugs at affordable rates, because these are costly medicine. In oncology, the medications which are newer innovations, they are way beyond even the upper class cannot afford sometimes. It is very expensive. But if it is really good, we have to make sure that somehow, sometimes there are expensive medications which are actually not landed into India. You can write to the companies and get it at a compassionate access. They are ready to provide it. When in early parts, once it is approved in India, yes, you have to buy it. So we try that also. Some newer mutation has come up and you have a newer drug which is maybe costing in lakhs. You just write a mail and try to get it at a free of cost. I have treated such patients of rare mutations where the costliest drug we have given to the patients, and it has changed stage 4 cancer where the patient कभी 6 महीना भी नहीं जीता, वो 6 साल तक जिया है. This is what happened in the last 10 decades. So a doctor alone can't do these things. You have to have a social worker sitting with you. Sometimes getting a biopsy is very important to decide, because if suppose there is a cancer, lung cancer, 10 patients comes to me. The treatment for each and every patient is different. It's not same. So I need to get the proper diagnosis. For that, I need a very good, excellent pathologist. I need to send that patient for biopsy to a person who can get adequate tumor tissue out of it. That process is important. So it's a teamwork. It's not only oncology work. For that, we are trying to get everything together in this business at an affordable cost, but world class. So the thought process started like this. And from there, we started our journey. I left Tata Hospital in 2012, 13. So it's almost a decade. Now I am into more than a decade I am into. And subsequently, my colleagues, Dr. Ashay Karpe came out of Tata Hospital, joined. Then Dr. Vijay Badil recently joined. And we are looking after specific tumors. So I'll come to a CAR T therapy. So Vijay is leading that project under different, it's a sister partnership where he is the face of CAR T therapy. It's a newer therapy, kind of immunotherapy, where cure is happening after many lines of treatment, many types of treatment when fail. And then the patient knows that there is end to it. This is therapy, newer therapy, which people are trying. The cost in Western countries in crores. My friend at IIT, Rahul Purwar, has done a research on this CAR T therapy and brought down the cost by 10 times. And we have collaborated with him, Rahul Purwar. So his research is successful in Tata Hospital. Now we are trying to collaborate with them. We have already collaborated with them, and we are trying to do that therapy in private sector.
Tell me one thing, Dr. Bhosale. You mentioned that in Tata, there are different hospitals that have opened in different parts of the country, but the brand Tata brings the name trust and faith.
Absolutely.
Right?
Yes.
So how are you, because you have worked with Tata Group, so how are you using your learning of what and how Tata Memorial does, operate? How do you bring those learnings to Sunrise so that you are also able to build the same trust that Tata enjoys today?
So this is a very important question. You know why? Tata, can I use Hindi language or it has to be in English?
No, sir. You can speak. It's English.
See, so Tata name जो ऐसे नहीं बना है, एक दिन में नहीं बना है, एक साल में नहीं बना है, 2 साल में नहीं बना है. ये ट्रस्ट कैसे बना है, जो विश्वास कैसे बना है? Because they have actually cared for the patient. It's a patient-centric approach. It's a passion. It's a compassion. वो ऐसे खरीद के नहीं आती है. क्या है कि आपका गुरु जैसे होगा ना, वैसे चेला बन जाता है, right? So अच्छे लोग जुड़े. उन्होंने क्या किया कि अच्छे लोगों को लिया. Not only doctors, the scientists. अभी टाटा हॉस्पिटल में कभी गए हो ना, आप देखो कि वहां का वार्ड बॉय से लेके डीन तक लेके सब लोग ना ऐसे ना, एक तो बॉम्बे का है, एक तो सोचो बॉम्बे में एवरीबॉडी इज रनिंग टाइम पंक्चुअल डूइंग वर्क. दैट इज गुड थिंग अबाउट बॉम्बे. ऑब्वियसली दिल्ली आल्सो द सेम थिंग हैपेंस. But in Tata Hospital, if you go to the energy of every person, not only the doctors, see the nurses, see the paramedics, see the ward boys, everybody. So वो culture ना टाटा का culture है, everybody. And we obviously हम टाटा के अंदर घुसे, 5 साल काम किया और बाहर निकले तो हमें पता नहीं चलेगा culture अंदर कैसे आप सकते. Obviously we have been caring before that also. We used to look after the patients. But cancer के लिए क्या होता है? When the word cancer comes, it is like cancer means there were no therapies. If you look back 10 years or 15 years back, जैसे diagnosis होता था, even doctors भी बोलते थे. मुझे कुछ लोगों ने बोला, why you are joining oncology? This is 15-20 years back. Why you are going into that field? Because, and see, it was to some extent, there were no therapies, there were no innovations. Even innovations were happening abroad. Cost of therapy, like one cycle, 10 lakh rupees. Who is going to afford? 90% of your patients are not going to take that therapy. You can talk in scientific forum that this therapy can change way. The bone marrow transplant used to be lakhs. But the innovations have changed the face. In some of the cancers, bone marrow transplant, we used to cost 25 or 30 lakh rupees. That is, I'm talking about in year 2000. A simple innovation, you do a test, a mutation called as BCR ABL is present, you just give a tablet, patient is cured for years. No need of doing bone marrow transplants. So such innovations which can really change the way we treat patients and get cure for the patients. But again, there is a catch. But that tablet used to cost 1.5 lakh rupees to 2.5 lakh rupees per month. So when that tablet came in 2005-6 in India, the cost was that. But then, because it was patented, it was a huge cost. The NGOs came for help. There is a NGO which gone to government and say that the people are ready to help these poor patients because simple tablet can change the face of treatment. So there was a interaction with government. Again, taxes is a big issue, how to get the drugs. But ultimately, those needy patients who could not pay for their tickets could take that treatment free of cost, and those patients are living after 15 years. उस पेशेंट को जो बोन मैरो ट्रांसप्लांट लगता था, जिसका 25 से 30 लाख रुपए लगता था, जिसको डोनर भी चाहिए, डोनर नहीं है तो ट्रांसप्लांट नहीं, आपके पास 1 करोड़ रुपए है लेकिन डोनर नहीं है, नो ट्रांसप्लांट. So accessibility to treatment was the issue. So these innovations have actually changed the way we treat patients. And the motto, the main, I am saying, passion, जो टाटा हॉस्पिटल में ना, जैसे मैंने बताया कि कल्चर है, वर्क कल्चर है, everybody is patient centric, कि पेशेंट का भला होना है. बाकी देखिए happiness, money, everything is byproduct. The main thing is the patient should get whatever his right. And every patient on the earth, I'm not talking about Indian patients, every patient, poor country, affordable country, is their right to have the best possible treatment, not the first best, second best ideas if we cannot have access to this. And everybody should have that drive inside to achieve that goal. And that is what is happening in Tata. You go to Tata, you become like the Tata. So that is why in India, आप टाटा में 7 दिन भी काम करके आए और आपने बोला कि मैं टाटा हॉस्पिटल में, तो पेशेंट आपकी तरफ खींचा चला आएगा, because that patient feels that मैं टाटा में एक बार गया ना, मुझे कुछ अलग नहीं हुआ. And it's true to some extent. I'm not saying the other institutions are not as good as Tata. They are also equally good. Maybe some of these institutions are better than Tata. But डॉक्टर के पास जाने के बाद अगर पेशेंट को ट्रस्ट नहीं है ना, तो दवाई काम नहीं करती. ये सब बोलते हैं.
नहीं, बिल्कुल ठीक बात है.
The faith is important. The faith is very, very important.
So, Dr. Bhosale, जब हम faith की बात कर रहे हैं, like you said, that patients, when they come to know that they've been detected with cancer, the first thing that comes to their mind is death. कि अब the inevitable is going to happen, and whether it is a month or whether it is a year or maybe 10 years, but they know that it is sooner than what the unknown expiry date was. Now, a lot of it, and you also mentioned that there's a big role of psychology, psychiatry in managing the mind of the patient, because अगर faith नहीं है, trust नहीं है, तो नहीं होगा. In this case, how do you see the role of a doctor in when you compare the relationship that they have or nurture with their patients? How they break the news? Is there can the patient sense or smell hope in it versus he feels that they are doomed? How do you manage the mindset of a patient during the treatment when they are seeing their family troubled because of financial issues? So I'm sure there are a lot of these mental faculties that come into play and impact the treatment protocol and the acceptance of treatment by the patient. So what do you see should be the role, and if it is changing, how is it changing in today's day and age?
So ये बहुत ही ज़्यादा important questions है. Breaking bad news से शुरू होता है, and then acceptance, and then the emotional impact, as you rightly mentioned, the family is spending so much, whether I should take that treatment. अभी इसके दो पहलू है. One side I mentioned is a very bad cancer, because there are some cancers which actually we can't help it. we are also helpless. On the other side, there are cancers which can be completely cured, like pediatric cancers जो है, या फिर अर्ली स्टेजेस के ब्रेस्ट कैंसर जो है, जिसमें सर्वाइवल की हम गारंटी लिख के दे सकते हैं पेपर कि भैया आई एम डूइंग योर ट्रीटमेंट एट 95% चांसेस, व्हिच इज अ वेरी बिग चांस, राइट? बट एट द सेम टाइम देयर आर पेशेंट्स we know that in spite of doing whatever best possible in the world, the survival may be increasing by 1 month or 2 months. And sometimes there are situations where you should not actually treat that, because that treatment may be harmful to that patient. Like elderly patient whose heart is not good, patient is on ventilator, and the diagnosis is very bad, the disease is very much advanced. The first thing is breaking bad news to the patient as well as the family. Most of the time, what happens, families are under the impression if the patient doesn't know, he will do better. That is a wrong perception, absolutely wrong perception. But then आपके पास पेशेंट आता है तो डायरेक्टली आप नहीं बोल सकते कि तुम्हारे पास 4 दिन है या 4 महीने है, राइट? इट हैज टू बी अ सिस्टमैटिक प्रोसेस. फॉर दैट यू हैव टू अंडरस्टैंड द साइकोलॉजी ऑफ द पेशेंट. सो फर्स्ट जो सेशन होता है हमारा, when the patient family and patient comes to us, you have to listen to them rather than tell them that no, this is the treatment, this is the cost, and then this is the survival. It's not like that. First is the responsibility of a good oncologist or a good nurse or the good paramedic, or in fact, you can say my receptionist who is at the front desk, to listen to the patient. Because कैंसर है अगर पता है, वो बड़ी न्यूज ही उनके दिमाग में ना, जैसे आपने बोला कि there is an end, and which is not true. So you understand the patient psychology and accordingly, break that news, be it sudden, be it stepwise, because the family is like, no, please don't tell the patient. तुम पहले आएंगे, मैसेज करेंगे. बट कभी ना क्या होता है कि पेशेंट अगर टाटा हॉस्पिटल जा रहा है और आप बोल रहे हो उसको मत बताइए कैंसर है, सो पेशेंट को लगेगा मुझे मिस इन्फॉर्मेशन देके कुछ तो भयानक हुआ है, एंड दे आर ट्राइंग टू हाइड फ्रॉम. इसमें नुकसान उसको पहुंचता है जिसका अल्टीमेट डायग्नोसिस का प्रोग्नोसिस जो बहुत अच्छा है, जो क्योर होने वाला है, ही विल बी अंडर इंप्रेशन दैट देयर इज समथिंग रॉन्ग हैपनिंग. The cancer तो है because I am going to an oncologist, because nowadays through Google you can just put up Dr. Bharat Bhosale, वो oncologist तो आने वाला है. So if the patient is coming to Bharat Bhosale cannot hide the things. And if I hide, patient के मन में अंदर ना युद्ध शुरू हो जाता है, मैं कितने दिन. So it is better tell them that you are going to get cure. बात आती है palliation की, उनको कैसे समझाना है. There are ways to it. Then I need the psychiatric person, psychological counselor, my paramedic staff, and it has, again, the palliation also is a good way. Because देखो, एक बहुत बड़ा famous dialogue है आनंद मूवी का, जिंदगी बड़ी होनी चाहिए, लंबी नहीं, या whatever है, बड़ी बोलो लंबी बोलो, meaningful life is very important, जिसमें पेन ना हो, ना इमोशनल पेन हो, ना फिजिकल पेन. फिर आप 6 महीने जीते हो और या 60 साल जीते हो, बेड रिटर्न रह के कोई नहीं जीना चाहता है, जो देख रहा है कि मुझे पेन हो रहा है और मेरी फैमिली सफर हो रही है. सो इवन इन cancers where the survival is limited, why can't we put our effort to make their life happy?
Correct.
वो 6 दिन की रहे या 6 साल की रहे या 6 महीने की रहे, your entire efforts then should not be given chemotherapies and targeted therapies. Don't look at because there is a financial toxicity there. When we know this is not going to get into bigger change in terms of the survival, sometimes we have to convince the patient, Baba, don't spend money, spend time with the patient. For that patient, your family's time is important. Don't spend that time in the hospital, in the ICU, on the ventilator. So ये counseling का time ना हमें patient को उसके लिए देना चाहता है कि there is no point in putting this energy, money and time when you are sitting outside the ICU and patient is on the ventilator.
Correct.
तो ये एक पार्ट हो गया. और दूसरी पार्ट जो मैंने बोला कि जिसका प्रोग्नोसिस अच्छा है, जो अच्छा होने वाला है, उसके माइंड से नेगेटिव थॉट्स निकालने हैं, उसको पॉजिटिव एनर्जी नहीं. क्योंकि मैं कितना भी ट्रीटमेंट करूं, अनलेस एंटिल द पेशेंट थिंक्स पॉजिटिव ना, ये मैं लिख के देता हूं. अगर पेशेंट पॉजिटिव सोचता है ना, तो आपका डबल गुना फायदा होता है उसमें, और हमेशा फायदे की बात करनी चाहिए.
नहीं बिल्कुल. एंड डॉक्टर भोसले, मेरे को ये आपने बहुत इंपॉर्टेंट बात करी है कि अगर पेशेंट पॉजिटिव सोच रहा है तो उसका फायदा होगा. लेकिन जब हम देखते हैं केयर गिवर्स हैं, जो फैमिली विच इज अराउंड टेकिंग केयर ऑफ द पेशेंट, एंड द फ्रेंड्स, फैमिली एटसेट्रा, हुएवर कम्स इन, वो कहते हैं यार पॉजिटिव सोचा करो, नेगेटिव मत देखो. वो पेशेंट कहता है कि यार आप क्या बात कर रहे हो, मुझे यही नहीं पता मैं सुबह उठूंगा नहीं उठूंगा, और आप मेरे को कह रहे पॉजिटिव सोचो. सो देयर इज अ लॉट ऑफ टॉक्सिक पॉजिटिविटी व्हिच इज देयर.
Yes.
And there's not much of, every therapy, I mean, I'm not even talking of the medical side of it, even the psychological side of it, the support groups, etc., everything is centered around the patient, but nobody is going out and training the caregivers as to what is it that they need to do. What do
Absolutely.
you think should be happening to train the caregivers to do the right thing in the interest of the patient?
बहुत important चीज है. Not only the other paramedics, it is the doctors. Sometimes no, we need to understand the needs of the patient. Not sometimes बहुत simple needs होते हैं. I'll share you one good experience. See, I learn from my patient daily basis. So I was sitting in a busy OPD, and just one second, I'll just reply to a message. So patient आया consulting में, बात हुई. She was a doctor's mother, and जाते समय उन्होंने बोली, वो उठ नहीं रही थी, बोले कि स्माइल किया, बोले सर हमेशा कंसल्टिंग में आते हो तो आप शेक हैंड करते हो मेरा. सो थी डॉक्टर पेशेंट रिलेशनशिप बिल्ड बहुत इंपॉर्टेंट. जो ट्रस्ट की बात आती है ना, तो सिंपल टच पेशेंट को भी ना बहुत मायने रखता है. आप जैसे कि आर्टिफिशियल नहीं रह सकते कि हाँ आपने ये बोला ये ट्रीटमेंट लेके जाओ. दैट इंटरेक्शंस बिल्ड्स अ इमोशनल बॉन्ड एंड फेथ, and that also induces a positive energy. And it's not true for only doctors, my staff, how they behave with the patient, that is also important. Their simple interaction with the patient creates a positive energy. पेशेंट कीमो के लिए आएगा ना, साइड इफेक्ट के बारे में सोचेगा नहीं मुझे उल्टी होगा, बोले यार मैं जा रहा हूँ ना वहां पे एक अच्छा एक्सपीरियंस होगा. ये चीज है ना, ये चीज बहुत बहुत इंपॉर्टेंट होती है. आपने जैसे बोला कि उनको ट्रेन करना जरूरी है, बिल्कुल जरूरी है. अनफॉर्चुनेटली क्या है कि नंबर ऑफ डॉक्टर्स फॉर नंबर ऑफ पेशेंट्स, ये रेशियो मैच ही नहीं करते इंडिया में. कहीं बैठ के 150 पेशेंट देखेंगे तो हर पेशेंट के लिए कितना टाइम आता है आप काउंट करिए.
Correct.
So you have to do a triage.
But Dr. Bhosale, this is very important. The doctors in India, because of the doctor-patient ratio, they don't have enough time. I mean, I've seen doctors in the West who work for 1 week and then 1 week is छुट्टी. यहाँ पे तो they don't have time for their family also. I mean, the OPD is so busy and then surgeries, etc. Now, keeping that in mind, not everything can the doctor do
Yes.
on their own. So there has to be a
Absolutely.
collaborative approach. What kind of a collaborative approach have you, kind of worked out in Sunrise, which is unique and makes things easier not only for the institution but for the doctors, but also useful for the patients?
So अभी देखिए ना, I'll tell you, emotional need के लिए psychological counseling है, जो not necessarily always somebody has to sit physically. Nowadays after COVID we have learned like we are talking to each other. पहले आप खुद मेरे पास आते या मैं आपके पास जाता, but now we are having a good interaction virtually. So we have counselors, क्योंकि counselor भी हमें there are freelance good counselors who can according to the time can interact. So we have collaboration with counselors, psychological counselors. There is something called as a coming up with genetic things, family में cancer के cases है, there are genetic counselors. We have time. Diet is an important weapon to fight against cancer. There are myths about the diet. So we have excellent dietitians who can counsel as per the need, because कोई वेज होता है, कोई नॉन वेज होता है, कोई साउथ का होता है, कोई नॉर्थ का होता है ना. आप स्पाइसी खाते हो, मैं महाराष्ट्र में, मैं भी बस स्पाइसी खाता हूँ. Somebody is not into spices. So according to their needs, the dietitian has to plan a diet also. So those things also create big difference. So all those types are very very important. Patient listen to these things, get engaged into things and forget their worries. So ये टाइप्स करने बहुत जरूरी होते हैं, और अच्छे लोगों के साथ टाइप करने जरूरी होते हैं, rather than just giving something extra just to feel that ये भी दिया है. So as I said, psychiatric or psychological counseling, the diet counseling, the genetic counseling, ये चीजें we have a type collaboration with those experts in the field, and as and when the physical interaction also happens. As I previously mentioned, we try to get the supportive care also cheaper rates and cost, which are the costlier medicines. That is also there. We are trying to bring down the cost, so patient also feels that the financial burden is reduced. So these kind of the collaborations are very important. We have a collaboration with the NGOs where once in a week they come and see which patient is poor. They independently assess the financial background. Today I got a mail that we are sending 30,000 for this patient because you are also doing helping this. So ऐसी चीजें daily basis पे होते हैं. तो ये collaboration करना जरूरी है. Not necessarily only counseling, financial counseling and finance कहाँ से लाए, ये भी एक important issue है.
बिल्कुल. And Dr. Sahab, one of the challenge that the patients I am observing are facing today is getting genuine advice, you know, and which is why when they come to a hospital, the relationship with the doctor is more towards कि यार क्या मेरे को ये वो ठीक चीज बता रहे हैं, क्या ये genuinely मेरे को ठीक बता रहे हैं, या फैमिली ने रोका है इनको कुछ बताने के लिए. So all kinds of questions come into the mind. And this is also because I've seen patients when they go, and the families, the biggest dilemma that they have today is that they don't know what is the right treatment for the patient. क्या कीमोथेरेपी करनी चाहिए, या पहले सर्जरी होके फिर कीमोथेरेपी करनी चाहिए, या रेडिएशन करनी चाहिए. उनको नहीं पता कि जो ट्रीटमेंट दिया जा रहा है वो करेक्ट है कि नहीं है. एंड अनदर thing that people ask, I'm actually writing a book on oncology, experiences of cancer patients. So I know that, one of the things that they dabble with it कि यार कीमोथेरेपी से फर्क पड़ेगा भी सही, या देनी भी चाहिए नहीं देनी चाहिए, ठीक है. या फिर हम सर्जन के पास जाते हैं तो वो सर्जरी बताता है, अगर हम ऑन्को फिजिशियन के पास जाएंगे तो वो कीमोथेरेपी बताएगा. So how does a patient understand what is the right treatment protocol for them?
So ये बहुत इंपॉर्टेंट है और पेशेंट लोगों को पता होना जरूरी है. There is something called मल्टी डिसिप्लिनरी टीम मैनेजमेंट. जैसे मैंने सर्जन बोला, आपने रेडिएशन बोला, कीमोथेरेपी का, मैं जैसे मेडिकल ऑन्कोलॉजिस्ट हूँ, जो जिसके पास जाएगा वो अपनी ट्रीटमेंट हो सकता है. There is a bias, but we at Sunrise Oncology, we have our colleagues from the surgery department, radiation department. We conduct tumor boards where every case is being discussed in that tumor board, and the opinions are sorted from our surgeon colleagues and radiation colleagues, and this is signed and given to the patient that this has been discussed with all together. ये जो जेन्युइनिटी होता है ना, पेशेंट भी बिलीव करता है कि मतलब उस पे फेथ रखता है कि यार सर्जन ने इसके साथ डिस्कस किया है.
Is this for all cases?
Yes. सो क्या है कि अगर मेरे सर्जन को लगता है नहीं भरत यार पहले इसको सर्जरी करते हैं, भरत को लगता है कि यार नहीं इसमें कीमो का फायदा होगा, साइंटिफिकली बेस्ड, नॉट अ रैंडम थॉट कि भरत को लगता है. Based on the data which is there in science, we discuss that, and ultimately why we are doing this, for the benefit of the patient, maximum benefit जिसमें है वो अप्रोच करना है. ये टाटा में यही होता है, हम टाटा से सीख के यही है. ट्यूमर बोर्ड्स एंड लार्जली वेस्टर्न कंट्री में ये भी ऑर्गन स्पेसिफिक डॉक्टर रहते हैं कि ब्रेन का डॉक्टर अलग, हेड एंड नेक का डॉक्टर अलग, ब्रेस्ट का डॉक्टर. जैसे हमारे यहाँ पे हमने स्पेशलिटी डिवाइड करके रखी. मैं सब कुछ ट्रीट कर सकता हूँ, ब्लड कैंसर से लेके कार्डी सब करता हूँ, लेकिन मेरा डोमेन स्पेशलिटी ब्रेस्ट कैंसर है, लंग कैंसर है, इम्यूनोथेरेपी है, जीआई कैंसर, स्टमक और कोलन की कैंसर्स. फिर दूसरे पार्टनर्स मेरे ब्रेन देखते हैं, और एक पार्टनर है वो ब्लड कैंसर्स देखते हैं. So then you read a lot about that, whatever research, because oncology is fast growing, research is coming daily basis, so you have to keep a pace with that. So if I am reading breast, so I have a high volume research done, research read, so decision making becomes easier, and patient knows all this thing nowadays. डॉक्टर भरत भोसले के पास जाके ये डिसीजन लिया, वो जेन्युइन ओपिनियन आ रहा है. ये जेन्युइनिटी है ना, ये लानी है सबको, नॉट ओनली सनराइज, एवरीबॉडी शुड प्रैक्टिस दैट. सो एट सनराइज ऑन्कोलॉजी I have the first priority is genuinity. मुझे जो है, मैंने जो सीखा है वो ट्रांसपेरेंटली पेशेंट को बताना है. Even if the patient is going to survive for 6 months, I am not going to force him to buy expensive medications if that is not adding any benefit to the patient. I will be truthful to the patient. I will be genuine with whatever happens. My genuinity will not be compromised by one person. That is for sure. And ये जो है ना, ये टाटा हॉस्पिटल के स्टूडेंट्स है. Again, I am not saying no, every institute is good, but मैं टाटा में गया हूँ, टाटा से बाहर आया हूँ. मेरे टीचर जो है अभी टाटा के डायरेक्टर है, डॉक्टर सुदीप गुप्ता, उनके अंदर मैं पढ़ा हूँ और वैसा बना हूँ. And it is his word when he came to inaugurate our session. He said, "Sunrise is Bharat and Sunrise, his team is an extension of Tata Hospital." You can say.
That means a lot. That means a lot.
Yes.
And Dr. Bhosale, reflecting on your journey from Tata Memorial to founding Sunrise Oncology Centre, what do you consider to be your most significant learnings, lessons that have shaped your leadership and vision for Sunrise Oncology?
So you see, I thanks to the God that I got into Tata Hospital. It's a big mandir for us, though. For every patient, for a doctor, you have so much learnings around. See, you have to learn from the pain. So हमें है ना, हम हमेशा क्रेव करते रहते हैं कि यार ये प्रॉब्लम है, वो प्रॉब्लम है. लुक एट पीपल, नो, दे हैव सो मेनी प्रॉब्लम्स, स्टिल दे आर स्माइलिंग. स्मॉल किड्स, 2 साल का बच्चा है, 10 साल का बच्चा है, उसको कैंसर का, लेकिन खेल रहा है वहां पे. So apart from what I learn in oncology and business, there are so many things you can learn for yourself also. And that is what we learned at Tata Hospital. Obviously, we were privileged to have the best researchers as our teacher, mentors. वो तो सारी चीजें सीखी हमने. The best people in the world were our mentors. They are mentoring us today also. Any problem happens, they are accessible to us. ये सारी चीजें सीखी. एक कल्चर आ गया, टाटा हॉस्पिटल का एक कल्चर आ गया. एंड दैट वी देन थॉट, ऑब्वियसली बाहर जाके प्राइवेट सेक्टर में ऐसा कुछ करे कि लोगों को प्रॉब्लम क्या होता है कि टाइम नहीं मिलता एक दूसरे के साथ इंटरेक्शन करने के लिए फॉर एवरी पेशेंट्स. हियर वी आर ट्राइंग टू स्पेंड टाइम एंड वी आर मोर इनटू लिसनिंग टू द पेशेंट्स, नॉट गिविंग गाइड. आपको नहीं गाइड करते हैं, गाइड ऐसा नहीं होता है. आप देखो, उनको सुनो, देन विल रियलाइज. समटाइम पेशेंट्स, आप बैठो उनके साथ कॉन्वर्सेशन तो रोने लगते हैं. व्हाई यू आर क्राइंग? you are listening to us, that is the answer. So मैं तो शॉक में जाता था पहले, ऐसे क्या बोल रहे हैं. तो पेशेंट बोलता है डॉक्टर साहब आपने सुना हमें. सो सुनना भी एक बड़ी चीज है, इसके लिए पैसे नहीं लगते. one has to give just time. Obviously every patient you don't have to sit and answer, but there are people you will realize they just need time and just listen to them. आधे प्रॉब्लम सॉल्व हो जाते हैं. सिंपल से प्रॉब्लम. See what medications they are taking. If they are taking too many medications, reduce the number of medications. Problem solve हो जाते हैं. You don't have to add the medications. Simple से solutions है. 50% में यही करो. I'm not saying you stop all the medications, but you just go through what is required to them, listen to them, and बाकी तो हमें पता है क्या करना है. ये कैंसर को ये दवाई है, ये कैंसर कितना डोज में देना है, कितना कम करना है, क्या साइड इफेक्ट है. ये तो आर्टिफिशियल इंटेलिजेंस भी करेगा. कल आर्टिफिशियल इंटेलिजेंस आ गया तो हम कहाँ जाएंगे. Health sector में the doctor has to be genuine, the doctor has to be human, the doctor has to show the passion.
बिल्कुल बिल्कुल.
बाकी
सर,
सब
आपने अभी बात करी आर्टिफिशियल इंटेलिजेंस की. व्हाट डू यू थिंक इज द रोल ऑफ आर्टिफिशियल इंटेलिजेंस इन टुडेज डे एंड एज? अभी जो आने वाला है वो तो इज गोइंग टू बी वेरी डिफरेंट. बट हाउ इज एआई हेल्पिंग यू टुडे?
सो ऑन्कोलॉजी की बात छोड़ के अगर आप एआई की बात करोगे ना, पहले एआई आ चुका था और फेल हो गया कुछ साल पहले. You also know that artificial intelligence has been tried and it has failed in a big way, and human has to learn their own from their own mistakes. Artificial intelligence नहीं चाहिए ऐसा नहीं बोल रहा हूँ. It is required. In a country like India, somebody who is in Nagaland, they don't have a single medical oncologist. North East region में आप नंबर देखोगे, number of doctors is very less in oncology. So it will try to minimize the errors happening over there if I can monitor from it. So I will not go into details of that. So artificial intelligence is going to help us, but at the end somebody human has to be sitting there. You can't just give instruction to a machine.
Got it.
नागालैंड में पेशेंट मशीन के सामने आके नहीं बोलेगा ये कैंसर है ये दवाई दो. Somebody has to sit over there. So you can't replace, like अभी रोबोटिक सर्जरी जो है, तो लोग बोलते हैं कि आपने अगर रोबोट के साथ सर्जरी किया और एक 10,000 सर्जरी करने के बाद रोबोट की पता चलेगा हर सर्जरी में क्या कॉम्प्लिकेशंस आते हैं, कहाँ से हाथ डालना है, कहाँ से नहीं डालना है, कहाँ से. So they said that after 10,000 surgeries, the robot will do surgeries on its own. So I don't think somebody has to guide it, because robo or AI doesn't have emotions, and the health outcome is purely emotional based, and the disease also has its origin in emotions.
Got it. And sir, what is the future of Sunrise? I mean, what are your expansion plans? How many doctors do you have now? How big is Sunrise? How many centers? And what's your plan for the near future?
So Sunrise is now Sunrise. So we are rising. And I have two colleagues who are medical oncologists, Dr. Vijay Patil and Dr. Ashay. They are medical oncologists. They are, and we have other doctors also. Girish is our MBA partner. He looks into the administration part. Because you also know there are a lot of things which happens in the office also, and we are being a clinicians, we are very poor in terms of the other aspect. But yes, we have learned management also. Now we are better know how is the marketing works, how the other heads work. So we also contribute to that. There are other people's oncologists like-minded. It's very important. Like-minded people are also joining. So we are extending. Now we have center in Andheri, Borivali. We have 2 centers. One center we have with association with an NGO called as Nana Palkar and Tata Hospital, where patients get free of cost treatment. There's another center, charity center, semi-charity center in Vasai, where the Sunrise is setting up a daycare inside a hospital called as Cardinal Gracious. In Thane, Dr. Vijay Patil is heading that project, coming with the research center, where patients get some newer molecules, newer innovations through research. Sometimes they are free of cost. So Vijay has a research interest. He's trying to establish the CAR T therapy over there. So maybe in next 1 year, the CAR T therapy, which is the latest therapy, will start under Sunrise. Goa, we are visiting once in a week. So we are going to have a dedicated center over there. So Vasai hai, Thana hai, Goa hai, Bombay mein Andheri hai, now Prabha Devi and Khar, we are coming up with centers. So yes, we are expanding. So hopefully ये number बढ़ता जाए ताकि लोगों तक Sunrise पहुंच जाए.
Bilkul. And what are your plans of going beyond Maharashtra? Are you looking at hiring more doctors, opening more centers across the country?
Yes. महाराष्ट्र के बाहर तो गए, गोवा में physical presence है Sunrise का, and obviously things are going in right directions. We'll definitely go outside Maharashtra, but the main thing is the intention of every doctor who is joining Sunrise has to be same what I have been talking to you in the last couple of minutes. It's the intention of everyone to help the patient. It will grow fast. I'm telling you. We just have to come together for good thing, and that has to be the patient outcome.
Right.
A quality patient outcome.
Have there been a patient who has surprised you? You thought that, this patient may not survive.
Yes.
They have survived, they are living. I mean, if there has been a case like this, what did you observe in that patient? What worked?
So I have many cases. If we should meet personally and I'll give you exact details. They have surprised me. There was a guy, he's still alive, and I am going to administer a newer innovation to him. He was 85 years old, 6 years back before COVID. So we were talking about surprises, and I am happy to see those surprises daily basis, because those surprises are so good to feel, because here you see the patient is not going to survive. So this gentleman, actually a 85-year-old man, thin guy, came to me with a stage 4 lung cancer, and somebody, my colleague or some other oncologist said, you are old, these medications are toxic. He was a case of lung cancer. And the chemotherapy was the only treatment for him as per the reports done in 2019, because the innovations in terms of diagnosis or genomic sequencing were not that good in that time. So I said, patient looks fit to me. I said, Aapka weight, bachpan se hi aisa hu. And he was thin built, but his energy was so much. He said, I'm ready to take that treatment. So we started with the chemotherapy, and he has an excellent response. So 2019, he responded to chemotherapy. Unfortunately, COVID came, and COVID, he had a bad time in terms of some infection. And everybody in 2020 used to be labeled as COVID. He went into the ICU, COVID was negative. He came out, but there was a lung shadows. Initially, we thought of COVID, but it was a disease progression. Then we put him on immunotherapy after that, because he was mutation negative. He responded to immunotherapy. In second wave, unfortunately, he actually went on ventilator and he had COVID, not the disease progression. So, as you said, we discussed that he has a stage 4 lung cancer. He's 86-year-old, why to know? But then they have already taken a call and he was on ventilator. Again, second surprise. So first surprise was he was denied chemotherapy. I gave chemotherapy, he survived. He took immunotherapy. There was a pseudo COVID. He went into ICU, came out. Second wave, he had actual COVID, went 11 days on ventilator because of COVID, came out. God only protected him. But this time, he has disease progressed, and there was a node over here, a growth coming out of the neck. I did the biopsy. Sometimes, you say, why he is surviving out of this? Let's do a repeat biopsy. And I sent for sequencing. There were 2 mutations came positive, something called as EGFR and HER2. So I gave a low dose of chemotherapy till the time the report came. With chemotherapy, the disease again gone, completely gone. So I put him on a tablet at the end of 2020. From 2021 January till the time he was on that tablet, till this date. Imagine 19, 20, 21, 22, 23, 5 years. Actually, 2018 end, I diagnosed this patient. So this kind of surprise, and this is purely because of innovations. And this gentleman now has since 1 year now, he did not follow, because I kept on, because this is a special patient to me. I keep on calling him because he is now nearly 90. And still there is new mutation come up. He said, I will take that treatment. So this is positivity. I never saw this patient in pain. Right now, he has so much pain, but the attitude is so much positive. I feel somewhere that is helping. Your genes are important, but your attitude, your positive attitude is very important. In a stage 4 lung cancer, where the survival was not more than 8 months, for an 85-year-old patient who is nearly 90 now, he's been surviving through all COVIDs. When we lost healthy, no, young, fit, our colleagues we lost in COVID. सो ये सरप्राइजेस हमें अच्छे लगते हैं, और ऐसे सरप्राइजेस होने चाहिए, डेली होने चाहिए, और ये पॉजिटिव एटीट्यूड जो है ना, यहाँ पे मैं बहुत देखता हूँ.
So positive attitude is something that you feel gave him that strength. Ki, let me,
Yes.
I'm okay to accept innovations, do something new, and I'm okay to accept whatever my doctor is telling me, and go with the positive attitude कि कोई अच्छा ही निकलेगा.
Yes, yes.
Is that correct?
Yes, yes, absolutely. But ये
Awesome.
सब चीजें feasible होने चाहिए, accessible होने चाहिए. That's why Sunrise is there, to reach out to the people with all these innovations.
Dr. Bhosale, I mean, it has been such a pleasure speaking with you
Same here, same
to
here.
understand that, what you think about what the right kind of a treatment should be, which is what you spoke about, holistic, have psychiatrists, have the right people in the institution who can do things which the doctor should be doing but has no time to do. And second thing, I remember you mentioning that the basics of what the patients expect, which is somebody to listen to. इन्होंने मेरी पूरी बात तो सुनी है. That impacts their faith and relationship with the doctor, and that is when they are more open to accept the treatment with full faith कि ये doctor ठीक है, अच्छा काम कर रहा है, I'm in the right hands. So that, and lastly, the story of how an 85-year-old patient is still surviving despite all odds, just because of the positive attitude. So that's a very big inspiration for the patients who may be listening to this conversation. Thank you so much for taking out time and sharing all these pearls of wisdom with us. Thank you.
Thank you so much. Thank you.